Thank you for joining us at our Prestige PEO webinar series. My name is Carrie Kaiser. I'm the Marketing Operations Manager here at Prestige PEO, and I'll be your host this morning. In today's webinar, we'll learn about our new partnership with Solstice Bnefits and discuss their National Open Access DHMO dental plan and how it compares to other providers. Joining me today from Solstice is Mark Sophia, Regional Vice President of Sales. Are muted by default. However, we encourage you to make use of the chat feature to pose any questions you may have. We'll respond to them towards the end of the webinar, time permitting. If we're unable to get to your question, we'll reach back out to you shortly after the webinar concludes. You can find a recording of this webinar along with other open enrollment information by visiting our Open Enrollment Resource Center at prestigepeo.com/open enrollment. And now we'll get started with the webinar. Welcome, Mark.
Welcome, everyone. I want to thank Carrie and the team at Prestige for having me here this morning to tell you a little bit more about Solstice. We're going to be a new dental option for you coming this year for, through your renewal and for any new business you have. So I'll get started with it, and hopefully we've been in the New York area for, 14 years. I helped open up this market. So there's a lot of brokers and partners out there that I know I've worked with for years. I've been in this area since 1986. I've worked in the health side for most of my life with a little detour into the mortgage business. And I eventually fell back into the dental and ancillary side when this opportunity came up. So, that's me. Some of you may know me. It'll be interesting, who knows me and who doesn't, but hopefully by the end of this, you'll have a lot of information and you'll be able to go forward. As Carrie said, we kind of like to hold the questions to the end. If we can, some of the stuff will be in there or put it in the chat, and what we can't get to, we will certainly get back to you on. All right, well, let me get started here. All right, so the agenda today, a little bit about Solstice, who we are, talk about our EPO DHMO. It's one of the same, Solstice Access Plus, which is the product you will be selling in every market except Texas, because they don't allow that product, but they're basically they are the same, except for the Access Plus offers some out-of-network services. Our DHMO, which makes us unique, is our open access model. Talk a little bit about the network, how to find a provider, and some of the network perks. So really quick on the background. Solstice started in 1997 by a couple of dentists down in South Florida who were trying to find a better way of offering dental insurance, and they knew from their own practices we're getting thousands and thousands of dollars in capitation fees. And they said, if we're going to start a plan, there's no way we can do this unless we do something different. And they created a discount fee for service model. What that means is the dentists only get paid when you are sitting in their chair. All right. So there's not that restriction of number of hours, number of days that they see the patients. Again, the dentists do not get paid unless you are seen by them. They wanted to create something else different by having an open access model. We have no primary care dentist requirement. You just have to stay in the network, and everything should work out for you. Some specialty care, you may want to just make the phone call so you can get referred to the proper one, and that's pretty much about it. But we do have one of the largest networks in the country. We continue to grow. When we were in Florida starting out, some of the leadership on our team were with United Healthcare, and United actually had a need for a DHMO for the state of Florida employees. Well, they were not about to create, so they came to us. We created a white label partnership with them, and we've been doing business with them for, like I said, almost 20 years now. And now they acquired us about 3.5 years ago because they saw the the positive effects that this product can offer. So it's just a hand in hand that we have. So some people may not know the Solstice name. They certainly will know our parent company name, and we provide a lot of solutions, not only for United Healthcare, but several other dental carriers out in the market. And some you may know, like Equitable, Principal, Standard, United Concordia, Unum, even MetLife, believe it or not, in some markets, because they are very limited in what they do. Okay, the next thing I'm going to talk about is what's EPO and DHMO. Let me just see if I think the slide goes into it next. Okay, yeah, it does, of course. So as I was discussing with you guys, I was talking about the open access model, how long we've been around. We do have one of the largest networks, and we have no closed panels, so we continue to add dentists as needed. I'll give an example. When we took over the Village of Rockville Center, they were with Cigna, and one of the selling points was that we could pick up most of the dentists that they had within a 90-day. We had an agreement with them that we would get at least 90% of the dentists that they had in their network, and we did it. So, and the dentists liked it. They were, a lot of dentists don't like the word DHMO. They curse it sometimes, but this has been working out real good for us. And again, having that open access word. Okay, so what makes us different? We are not your typical EPO DHMO. And the reason it says EPO, again, in certain markets, we are licensed as an EPO. Some markets, it's a DHMO. So we just kind of combine them together. It's all the same product. Stay in network, get services with zero or some kind of copay, and you move on from there. We do cover more than 500 procedures. We cover more than any other carrier out there. It is open access, as I said, no office assignments. If you go to a dentist, I don't know if anybody's had experience. Maybe you're with, DHMO G or DHMO M or DHMO A, and your employee joined the plan, didn't pick a dentist. They had one picked for them. They go to that dentist after, having some pain. They go in there, they don't like the dentist. What's going to happen? Well, it was the 20th of the month. Now you have to wait till the 1st of the following month. And you have no idea if you're going to be on that dentist roster. You should be, but if you're not, you're going to have to wait again. So again, no rosters, no waiting period, no late entrant penalties. That is another thing with us. We have no late entrant penalties. We also have, no waiting period. I mean, as mentioned, no waiting periods, and that's on all of our products. We cover adult and pediatric orthodontia. We also cover implants as well as cosmetic services and pediatric services up to age 16, and that's for someone going to see a pediatric dentist. This is what's going to set us apart in this market for you. What we've done is we created a product. We started it in Florida. It's called the Solstice Access Plus. Same savings and consistency of a DHMO plan, everything you expect from a DHMO, co-pays, no claim forms, no primary care dentist, all of that. But we offer an additional 35 dental procedures at a reimbursement out of network. So I'll give you an example. You can go to an out-of-network dentist and get reimbursed $35. You can get a filling, maybe $18. But there's, like I said, 35, and it's pretty much 35 procedures, but it's pretty much your preventive diagnostic and some of your basic. All right. And again, I'm going to mention the 500 dental procedures, over 500. It's 535 right now. So again, we do cover more than anyone else. And that's a nice thing. So the employees or the member can take the benefit summary, and they're going to sit in the chair, and the dentist is going to do that examination and cleaning and whatever, and say, look, you need a filling on number 3, you need a root canal on number 16, this crown is cracked, whatever. And you can see the procedure codes because they're going to be written on your pre-treatment authorization, and you can budget yourself by how much you can afford because you know those costs are exactly what you're going to pay. All right. And we also will provide some concierge service if you need an introduction to a new dentist. We do that stuff too. We do cover implants, all components, and implants are not inexpensive. I mean, you can be spending up to $5,000 for one implant, and all the services are in there. It's probably about a 35 to 50% discount on each procedure, but you can look at the summary of benefits and see what you're going to be paying for. And again, it's a multiple service, go in, have the tooth pulled, have the bone graft done. You have to wait 3 months and you come back, they put in the implant. Maybe they put it in at the time of service. I've had a couple, so I've had it both ways. Okay. So again, this is a Solstice Access Plus. It's available in every DHMO market we have except Texas. That will be our regular DHMO. It's the same plan design, except you do not have those 35 out of network benefits. Okay. Same, the pricing is the same. It's just the state of Texas restricts the what we can do in those markets. All right, this is a nice leave behind or something, as a broker, you may want to talk to your clients about. Like I said, we take the most popular services and plans and have them move through. The other thing is by doing this Access Plus, it kind of combines a hybrid DHMO plan, and it's really preferred by a lot of employers and groups. The biggest problem, like I said, with most DHMOs is having to choose a primary care dentist, and if you don't like them, the changing and everything else. We've taken away that pain point. They've done plenty of studies. We've been doing it in this market for years. And like I said, everybody would rather be in a fee-for-service non-capitated plan than a capitated plan. So you can see the numbers here. These are true. This is, a lot of information through the, American Dental Association, Department of Health Services study. We really follow a lot on that stuff. Like I said, no rosters. This is a good thing. And I'll tell you just a quick story. We had the county of Montgomery County down in just north of Houston. And they had a carrier that we're familiar with, but anytime they needed to change a dentist, they had to bring it through their HR department. They couldn't deal with it. They didn't want it. They needed a change. So that's what was really our selling point. All right. We'll go to the next slide. Pictures. Okay, this is our map of our DHMO network. We're probably about 85,000 plus access points, and we do have one of the largest networks. You're looking here, you're seeing a few light green areas. Montana, I've been very good with my geography now. It's Montana, North and South Dakota, Nebraska, New Hampshire, Vermont, Maine, and Rhode Island. We do not have DHMO product in those markets for regulatory. It's just not existing right now. And then there's some markets out west like Idaho and Wyoming, very limited amounts of providers. Now you're saying, why do we have orange and why do we have green? So those orange states are actually the states that Solstice. Those were our original 7. And that's when we came into the market. While we were waiting for actually before United, purchased us, we were getting licensed in each of those states, and it was a long process for a lot of people. You're going to say, oh, why wasn't New Jersey in there? You're right there. Well, New Jersey wanted almost $3 million from a small company like us prior to us being bought by United in reserves, and they also treat their dental insurance like their medical. They want to. What do you call it? MLR on the medical side. They have DLR. So the 80% of your premium has to be paid out in claims and everything else. I don't know how 80% of your premium is going to be paid, and we got to pay the brokers, keep our lights on. and administrative costs. So we've been able to, in all these other states that you see in green, we have our paper is we use United's paper in those states. Okay, and prior to United, we were using Renaissance, and I'm trying to think if we actually used United Concordia at one time. I'm not sure, but you can see, like I said, we started in Florida. The network continues to grow throughout these markets. I'm actually responsible for the Northeast, Texas, and now we've just actually, as of April 1st, we broke into California, and that is a heavy, heavy, heavy DHMO market. And as of October 1st, one of the largest DHMOs has been acquired by Sun Life, and the state of California won't let them have two DHMOs, theirs and their acquisition company. So I've been getting slammed with opportunities to write DHMO, and it's where you see 10, 15, 20% here, you're seeing 40, 50, 60% out there. So it continues to grow. All right. And here's just remember one thing. You got a New York company that has multiple states. If there's if there's a network in that state, the employee can be in there. If you have multiple divisions, you're going to be based on your premium, or your rate is going to be based on your location. So if you're in New York, you have the New York rate, and you might have people in Colorado and Arizona and in Texas. Now, Arizona was a unique market for the DHMO. We picked up the state of Arizona, and through our partnership with United, they had the regular dental, and we have the DHMO. So we continue to pick up a lot of bigger, more prestigious accounts throughout the market. All right. I did include in this slide, this is a geo axis based on the current 15,000 or so members that are enrolled with Prestige right now, and we have almost 92% access in general dentists. That's a pretty good number. And again, you're going to see some of the weak areas like North Dakota, South Dakota don't have any members. You have some on the border here. Montana's getting more popular because people want to leave California to go to Montana, like my niece and nephew did. So we'll start talking about things like that. But again, there's not a lot of population in there, so it's not as heavy. Our East Coast really grew about 7 years ago when we again, before United had bought us, we had a private label arrangement with them when we wrote Publix supermarkets. I'm sure anybody who's been to Florida knows Publix, and they run up and down the East Coast, and they helped us expand our market share. Right. Again, this is for general dentists. And again, this is something I can do for clients, if you're not on the PEO, but this is what we're talking about now. We have, again, in specialists, we're at about almost 93% access. So it continues to, it's going to be hard not to find a provider in the marketplace that you're in. So let me just see what else I got here. Okay. Finding a provider, pretty easy. You just have to go to the Solstice Benefits website. It's like any other website. You need to, they're going to ask you, pick out the pictures of the bicycle or the bridge or, a car or a taxi. And, once you get in there, you're going to select dental as your product. You're going to select, we are offering 2 DHMOs for you guys. We have the S100B, which has much lower co-pays. It's a little more costly, but you're going to see, the difference, let's say in a crown is going to be almost $200. So it may be worth the premium. If, you find, you're going to be using this. If I'm speaking to employer groups, you want to look at it that way, but you can compare the two side by side. The networks are the same for either plan. All right. You're going to select the plan, and you're going to select the type of specialty. Go by general dentist, put in the zip code, put in 2, 5, 10, 25 miles. mostly here in the Northeast, you can put in a 10-mile or 5-mile run and you're going to be fine. You know, when I go out into Texas, I'm having to put 25 and 50. And again, rural areas are just like that. You know, people, I always, I have a very large mining company that's in Southwest Pennsylvania. And we they were looking up the dentist. And I said, oh man, the closest person is like, you know, for this your assistant is 35 miles from their house. And he was laughing. He goes, well, she has to go 40 miles for the supermarket. Okay. So it's all relative when it comes to that. Like I said, put in your zip code and hit search. All right. We do a lot of member perks, prenatal care. This is really important to us because we found out that um, pregnant women need these extra cleanings and periodontic care because any disease of the mouth can affect the birth of the child or affect the growth of the child. So that's what we do. We give them extra cleanings in the second or third trimester. And again, it's at no additional cost. And by the way, under our plan, you're going to get two cleanings a year. And if you want to have additional ones, they're anywhere from $10 to $20, depending on the plan you take. All right. We also do oral cancer screening. We'll do the brush biopsy. We have a discount pharmacy plan that comes with on all of our products. And again, today you're seeing a lot of discount pharmacy programs like GoodRx, the one that Mark Cuban's doing. Everybody has a discount plan. Ours comes with it, but we also cover certain pet medications. You know, there's a lot. You know, you can go to your veterinarian and they're going to say, okay, Fido is get real anxious about getting in this airplane, and I'm going to prescribe you know 0.25 of Valium for the dog, and you can get it filled under this program. So it's pretty neat, what we have. We also have a hearing aid discount program, and you can save up to 40%. It's through HearRx. They give you a nice 3-year warranty and a 1-year battery supply, and they'll give you a complimentary screening. All right. I took advantage of it. And I flew airplanes as a younger guy, and back then they didn't tell you to wear any hearing protection, and that propeller and that noise, plus a lot of concerts, and plus living in New York for all these years and going through the subway, my hearing got a little bit shot. My wife insisted on it, but she says it's selective hearing, but it is. It's honestly the hearing loss, but we do provide this stuff, so it's a nice perk that you guys get. All right, and again, I do want to stress the point that the program is an open access plan. It has more codes than anyone else. You're going to look at the pricing based on where the group is based, and we have 4 rating areas. I think we took California, then Texas, Arizona, Colorado, Illinois, Ohio is one rating area. California is a separate one. Then we have Florida, and then we have kind of the Northeast. But if you find yourself picking up a plan that's based in Michigan, we can talk. We'll tell you how to get that one through. All right, I guess the presentation has been recorded. I'd love to have a recording of this and see how I did on here, but the presentation is there for you guys to review. My information was in the front. Please feel free to reach out to me. Like I said, there are a lot of brokers and consultants on this call. Some are doing business with us. Maybe some are doing with me, but that's it. All right, we're going to take a question. Let's see.
Thank you, Mark.
Go ahead.
It's Carrie here. So somebody might have raised their hand, but I don't see any questions submitted in the chat feature. So if you have anything, please submit it. We'll let's see here. Something coming in. What are the premium costs?
They vary depending on the market. So, for instance, I'll give you an example. And again, I'm just going to use New York for now. Excuse me for shuffling papers here, but in New York for the S800, it's 1063 for an individual, 1888 for the S100B.
Do you have
And
Connecticut?
honestly, what's that?
Do you have Connecticut by any chance?
Yes, Connecticut's included in there, but the network is primarily in the southeastern, uh, some in the Danbury area, Fairfield, maybe up to New Haven, but it's a smaller network. We are starting to grow. We just don't find it being a very DHMO friendly market, but we do have providers. You may have to drive into the network, but thanks for that question.
What about North Carolina?
North Carolina, we do have a network down there. So if you're looking, are you looking for a group that's based in North Carolina or employees who live in North Carolina?
We'll see if they respond. I have one more question here in the meantime.
Okay.
My daughters will need braces. You said there is no waiting period. Is this correct?
That is absolutely correct. That's on any product that we have at Solstice. So I'm going to give a commercial for our other stuff. Yes, we have no waiting periods ever. And people said, how do you do it? I said, we've been doing it for a long time. We don't get hit with claims on there. So, and if there are brokers on here, they've worked with us, they know that.
Okay, and it looks like for North Carolina, it's an employee.
Sorry about that. I'm sorry?
For North Carolina, it looks like it's an employee that lives there.
So, like I said, if anybody has any, any more questions, like I said, you can, I know, do you have any stuff in the chat right now or?
Yeah, it says, how much is one-time benefit for each individual?
One-time benefit. Well, if you're, we have 4 tiers of coverage: employee only, employee plus spouse, employee plus children, and it can be as many children as you have, or family. And there's not any, when you're saying one times, are you thinking something like there is no deductible, so you don't have like 2 times or anything like that. Each member gets their benefits, and it's all based on them. And again, it's an unlimited benefits. There is no cap on an annual basis. You want to get a full rack of implants, you can.
Okay, great. I think if anybody has any like individual questions, they can reach out to their benefits specialist and find out what's right for them. But thank you so much, Mark, for this informative
No problem. And I was going to say, any of the benefit specialists, if you need to, and you want to bring me in on a call with your client or the broker, please let me know. I'm more than happy to go over this thing with you. I enjoy it. Like I said, I've been doing it for a long time. And again, it's dental insurance. It's pretty simple. We've made it real simple for you guys. And, I'm looking forward to this. So you guys, you guys have a great day. Anything you need, like I said, put the questions in, they'll come over to me and we'll take it from there. But thank you all very much.
Awesome. Thank you, Mark, and thank you everyone who joined us today. As mentioned earlier, you can find a recording of this webinar along with other open enrollment information by visiting our Open Enrollment Resource Center at prestigepeo.com/open enrollment. If you have any further questions, feel free to contact your benefits specialist for further assistance. And don't forget to check your inbox for our monthly Insights newsletter, delivering the latest HR news. Thank you all. We look forward to seeing you next time.